mind, but I think we should continue with this
outside
talk. So we'll continue with this talk on custom ocular process, which is the final frontier. I'd like to acknowledge the ocularists who are working with Access Eye Clinic. So when we have a patient who's one-eyed, we have to look at the patient with both sympathy and empathy. And giving them a poorly fitting process is not the ideal thing, and we want to give them a good process which makes them look as normal as possible. So many times you have patients who come with these kind of process, that is a stalk eye, and they may have other problems like severe inflammation, severe pain, and even these kind of disfigured process may be used by the patient. So the best solution for these cases is to use a custom ocular processes. The problems of stalk eye is that there is poor cosmesis, poor biocompatibility. It will destroy the socket anatomy and modifications are not possible. But on the contrary, custom ocular process is made by the ocularist and they try to match the other eye. It gives a lifelike appearance. It is always able to do some modifications and it maintains the socket anatomy. So what we do is we put in a little bit of PMMA, try to make a imprint of this particular socket, and then we can make a wax model out of it and then transform this, and then we do the iris painting and then finally implant it into the PMMA, white PMMA, and do a polishing, and finally we coat it with transparent acrylic to give this kind of clear appearance. So there are different kinds of patients that we may face. So this is a patient who's got an ill-fitting process, which is usually a stalk eye, and you can see that there is a crack in the stalk eye, and this has led to this kind of severe inflammation. So these patients, definitely we should go for a custom process for good cosmesis. Sometimes you'll have patients with smaller implants and then they put an implant and this starts extruding out. There's a lot of infection. So here again, you end up removing the implant. You may not be able to place a better implant. So a custom process might be an answer where you may not be able to place a second implant. Sometimes there are severe symblepharon cases where repeated surgeries may not be indicated, or the patient may not be willing for repeated surgeries. So what we do in these cases is we put the process with a small notch for this particular symblepharon. So it's pretty well and it fits very snugly and does not fall out of the eye. And sometimes you have these kind of patients who had severe chemical injuries and there is a lot of surface deficit, volume deficit, multiple surgeries have been undergone by the patient, and you find it difficult to convince them for further surgery. There is a lot of socket contracture with both fornix, inferior and superior fornix, and in these cases again custom ocular process would be the better answer. Mild microphthalmos, as you can see here, it's very easy to manage this by placing a nice process on top of the original eye without doing any kind of surgery. If there is moderate microphthalmos, we can even use custom-made conformers initially of smaller sizes, and then you keep on increasing the size of the conformer, and finally one can place a good sized artificial eye even in a very severe socket contracture. In severe microphthalmos, what we do is we place these kind of process, and you can see that they have got these small extensions, and on this we place a tape, and because of this tape it is fit snugly over the socket, and that leads to socket expansion, and finally we can put a small artificial eye inside, and over time this will going to expand as the child grows, and then we can avoid unnecessary surgery and we can expand this as time goes by. In complicated cases like cryptophthalmos, where there is, you can see there's a lot of problems, like there's absence of the eyebrow. You can see there is a problem of medial upper eyelid even on the other normal side. There's a little bit of symblepharon here, and here you can see that it is a total cryptophthalmos, totally hidden eye. We can definitely try these cases also. So here what we have done is we have opened up the socket where we want to create the eye. We have lined it with both lots of mucous membrane and amniotic membrane, and we have sutured, we also put a skin graft on top to create the socket, and this is the conformer inside, and over time it heals, and here we have tried to fabricate the custom-made process. This is the wax model. We have tried to give as much centering as possible, and finally we are able to manage with a decent size process. Of course there is not much of eyelid movement, but the patient looks pretty okay. I will not say it is 100% cosmesis, but this was a very difficult case which we have managed successfully. So even in these cases a combination of surgery and process is very helpful to rehabilitate the patient. If there is a small socket and you have a superior sulcus deformity, you can make a small wedge on the implant of clear PMMA or clear acrylic, and this can help in masquerading the superior sulcus deformity. Post-traumatic cases are very difficult, and many times we end up doing multiple surgeries. Like this is an inferior fornix sutures to form the fornix, and finally we will be able to give a decent size of process for the patient. This is congenital anophthalmia with a dermoid, so we do an extensive surgery. We also try to repair the lids. So we can always combine lid surgeries along with the prosthesis so that we can give a good cosmesis to the patient. So overall, the main aim here is to rehabilitate the patient, make them as normal as possible so they can face the society confidently. In microphthalmos case, again, we can put a nice prosthesis, and as you can see here, this is a pretty good process with good movement of the prosthesis and a near normal appearance. So prosthesis movement is also possible provided that we have done a good fitting or good measurement of the socket when we are putting the PMMA implant. This is a magnetic two-piece process. This lady was actually a gynecologist who was working in rural Maharashtra, and this was a stone which she had placed inside there, and on top of it she was using a stock eye. So what we did, and this is a very bony dry socket as you can see, so surgery is not a good answer here. So what we have done is we have made up two part process. One on the other side is this, the inner part which has got this magnet, and this is the outer part which is again got a magnet. So these are neodymium yttrium boron magnets which can be used. So just because this particular two-part process it is giving a lot of stability to the socket, and we've also painted the socket a little bit to make it look more normal, to good cosmesis to the patient. So custom ocular process is the answer for all these cases. So irrespective of how good your surgery is, finally it is the cosmesis which is going to be given by the customized ocular processes. So we have to look for good cosmesis, good process retention, good motility, and it should also be comfortable to the patient. So if possible, and if the patient can afford, we'd always like to encourage the patient to go for a custom ocular prosthesis. Thank you for your attention. If there are any questions, we're happy to take any questions.
Sir, I have a doubt.
But irritated socket, usually we try to avoid surgery if it is possible. And like these kind of modifications we can do with the processes. So we can use magnetic two-part process, or we can do a customized processes which is fitting well, or we can do a spectacle-based process or a stick-on processes. So various methods we use, or sometimes we try to fix it to the orbital socket, orbit rather than to the socket.
Sir, I had a doubt in the two-piece prosthesis for the patient. Some of our cases are now telling that the magnets have got rust and they are not working. That is a problem that we should.
These magnets are made of neodymium, yttrium and boron, and they're extremely powerful magnets. The problem is that the magnetic quality is going to last for 4 to 5 years. Okay. After the magnetic property will be lost. So in which case you have to go ahead with a new process. That is unavoidable. But nevertheless, it's a very good option because you're not doing any surgery and you're able to rehabilitate the patient very easily and very successfully, because it's a very powerful magnet, it doesn't fall. So we have to go ahead with a new process and replace the magnets.
Thank you, sir.
Are there any effects of magnet on the surrounding?
No, madam. So we have done quite a few cases, and we published also this for the first time in the world, the use of magnetic processes. So these neodymium processes are very safe for the orbit and for these tissues. I have read a lot of papers on this, and we've also used it for exenteration also, these magnets. So it is safe for the body. The magnetic effect or the radiation effect is very minimal to the surrounding structures.